Welcome to another beautiful week in sunny South Florida. This is Melissa P. Dunn, and welcome to another episode of the DunnWisdom Morning Show. We are heading into our 8th month. Oh my gosh, 8 months. What a blessing. I am the CEO of MD Marketing Network, the founder of this DunnWisdom movement, and now commissioner-elect for the city of Lauderhill, seat number 2. Today's guest is someone that I've interviewed several times before. However, this is my first time speaking with her on this channel. She is a physician. She is a scholar. She is an expert in public health as well as health policy. And she's one of my favorite people to talk to. Ladies and gentlemen, I want to introduce you to Dr. Michelle Powell of Powell Health Solutions in Miami Gardens. Good morning, Dr. Powell.
Good morning, and thank you so much, Melissa. I am first of all, congratulations on getting your seat. Woo-hoo!
Thank you.
You are so well and so deserving, and the community is blessed to have you as their spokesperson, as their advocate, as their leader. So thank you so much for taking up the mantle to lead that community. We need
Thank
you.
you. Thank you. I'm excited. I'm excited to help use my skill sets and my talents to help Lauderhill to become a healthier, more prosperous community.
Yes, of course, because no health, you can have all the wealth, and if you're not healthy, it's useless. It's useless. Sick in bed and not able to enjoy what your wealth has brought you, is so against principle. We are meant to be prosperous, but whole and complete.
Whole and complete. Yes, we are perfect, whole and complete. And it's good for us to remember that and start taking the actions to make that so, right?
Yes, affirm it every single morning, regardless of appearance. And I see a blessed in the back. Regardless of appearance, know the truth, whole and complete.
Yes,
because we know we can always change appearance like we change our living room.
This is so true. Hey, Sophia, good morning. Good morning. Good morning. Amen. We already have the choir going, right?
Way to start the day.
So, Dr. Powell, tell us a little bit about your the type of medicine that you practice.
I'm a family physician, which means that many people forget what family physicians traditionally have done, which is to take care of the entire family. I always say from birth to retirement. From you're born, we catch them, we pronounce them, and we take care of you throughout the entire age continuum. And so I chose family medicine because I love taking care of the family, and I love the diversity that comes with the family, whether dealing with the baby, the teenager, the young adult, and as we move into becoming seniors. So family physicians is the backbone of your health. They're the ones that you will see first who will identify if there is something going on, but also their number one role is to prevent things from going on. So I love being a family physician because I believe I'm the beginning and the maintenance of the health of families.
I love that you see folks across the spectrum from beginning to end. I think that's really powerful. So in theory, you could be seeing a whole entire family.
Yes, I do. I actually do. And what people don't know is that because I'm a family physician, but also because of HIPAA, regardless of whether I see a husband and wife, they are individuals to me and to all physicians, really, because we're required to maintain confidentiality through HIPAA, which is the Privacy Act. So I can be dealing with a husband who may have certain issues going on that concerns his wife, but our conversation and my work with him has nothing to do with the spouse. And then I'll see the spouse and I'll work with issues that the partner may have. And while I'm working with the husband and wife, they're still individuals with individual health needs. And I think it's marvelous because it's almost like a backdoor work going on in the family to keep it healthy and well.
So I know that you also have credentials in health policy and in public health. What made you decide to marry your clinical degree with a public health and health policy credentials?
I think what most people don't really understand, and in a nutshell, when you're a physician, you're working with the individual, that individual patient. When you deal with public health, you're now working with communities. So you're saying to yourself, okay, how do I make this person feel better? That's the physician. When you work with public health, you say, the question you ask now is not, how do I make the person? I say, how do I make the community better? Whether that be a African descent community, whether it's a Native American community, a female community, a teenage community, you're now looking at the community and how you make it better. And then I realized, well, I want to impact the world at large. And I found out that while we can, as individual physician, work individually, and even as um, public health people work with communities, our arms are tied if policies and regulations and laws do not support the work we're trying to do. For instance, with health policy, you now write the rules and regulations for governance of health. Health policy works with Medicaid, Medicare, the new Obama health system that came into play. That was health policy. And the impact, we can see the impact. For instance, this pandemic is being led not necessarily by the individual physician, but really by policy makers. What policies are we going to implement for the strategy to deal with this public health issue? It started with a policy. Yes, we are all across America going to wear masks and we will mandate it. And they left that mandate to each individual state. That's how you see policy. And then you now see that trickle down to how did that affect the actual public health? What happens to the community of people who work in hospitals? What happened to the community of people who don't have access to care, like urban centers of poorer communities? And that's public health. So I chose to learn a little bit about each because I really wanted to have long last significant impact. And I had to know, how does it affect the person, the community, and how do I make the changes that are permanent through policy?
I love that. I love that. And you're absolutely right. You and I have spoken when the pandemic first started about how important health policy was in our response, in our recovery, so to speak, if there is such a thing as recovery. And the states that made the decision quickly to mandate masks and quickly to shut down and mandate quarantine, and social distancing, I think, are the ones that we see are faring better
Yes.
in this pandemic.
In fact,
And
as
so,
you see, yeah, you see it. The ones that were late or never made mandates, we now seeing an extreme rise. It's a sad rise. And the current leadership did not take it seriously to institute what could have been a national policy that would protect this country. And so we are seeing the backlash of this late implementation. If, in fact, it's not even implemented in these states yet. And they will have to address that to see a change in this pandemic.
for
Hopefully, our new
sure.
president will do that.
Good morning, Peter. Thank you for watching. Welcome to the show. If you guys have a question for Dr. Powell, please do type them in the chat. So, Dr. Powell, you've been practicing in the city of Miami Gardens for a number of years now. How have you seen the policies? Because I know Miami Gardens is very committed to making policy decisions to improve the quality of life in the residents there. How have you seen that shift the quality of life in that community?
I think we're seeing that is a great question because I've been in Miami Gardens living probably about 15 years now, and it is a slow change. And unfortunately, sometimes working in government is quite slow. But I do see a directed effort through the current mayor, Oliver, who implemented a healthy program for the community. They were doing walks, they were doing bike rides, they implemented healthy people, Miami, healthy Miami Gardens, where now there's a whole communities and committees established for substance abuse and for nutrition and for primary care awareness. And I see a change as if I just drive down my block or I go to the park, I'm actually seeing people, even in the pandemic, with their masks, doing their walks every morning. And it makes me smile because I'm like, wow. And seniors are some of my biggest advocates for health that I'm seeing in Miami Gardens. They're at the park by the library in the morning from 5:30. And I see visibly, you can actually see people in the community of Miami Gardens taking an effort and making strides to improve their health, just walking every single morning, which is so amazing to me. It is so amazing.
Yeah, I love it. I've seen the change. I've seen the change as well. And I know a community across South Florida is looking at them as a model.
Yeah.
Excellent job you're doing, Dr. Michelle Powell.
Oh, thank you.
Continue to educate and serve.
Thank
What
you.
is the number one thing that you share with your patients when it comes to improving their quality of life?
I think across the board for anything in life, it starts with a decision. It starts with a decision and a commitment. When it comes to your health, you got to let go of, well, my mother, my brother, my cousin, this is just the way it is. A commitment and a decision to making your health the best health possible. Our motto for our office is taking your health from average to excellent. But it starts with a commitment of the patient saying, you know, I am finished with high blood pressure. I am finished with diabetes. I'm finished with being overweight. I'm finished with just being average with my health. I want to take it to the next level, which is better. So the first thing I always ask with a patient, and it seems strange, are you ready? Are you ready to change this?
Mm,
I cannot do what you don't want to do for yourself. And in my earlier days as a physician, gung ho, out of school, yes, I'm going to make everybody take care of themselves. We as physicians, if we really are honest, we are just the guide. We're just the guide. The patient actually does the work. The patient takes care of themselves. And we are there to assist and guide in the right direction. We have the wisdom and knowledge to know what that direction should be, but ultimately the patient is the master of their health. So my role as a physician now 25 years, I've grown out of you're going to do this or not to
and
I
you did it with a finger and the head.
okay, all right, what we doing here? Are we going to do this? Are we going to make this better? To I'm here to help you. Are you ready? Are you ready to change your life? And I
That's
will
really
go where
powerful,
you want.
Dr. Michelle.
I will go where you want to go, and I will guide you. And if you want to go fast, we'll go fast. And wherever you are, that's where we'll start. But I need a commitment first.
Mm. And then that commitment looks like what? Good
So
morning. Good morning, Miss Joy. Welcome. Uh-huh.
now, with people, with health, with relationship, with work, commitment shows up. Commitment shows up. If you're really committed to a relationship, you show up doing what it takes to maintain and support that relationship. If you're committed to your health, you show up doing the things needed to make that health well. For instance, if you have high blood pressure and your physician has already told you that you need to take these medications every single day, every morning at the same time, you don't have any side effects, then commitment shows up with you every single morning, taking that blood pressure medication every single day at the same time. It also means that you make decisions that you will not consume high in sodium, soups, frozen foods, eating a lot of appetizers when you go out to eat, which is high in sodium. That's how it shows up. Commitment shows up. You can look and tell when someone's committed. It shows up. You're committed to weight loss, you show up by every day getting up and working out, exercising or jump rope. You're committed to really spiritual health. You show up by meditating every single morning and doing your prayer work. Commitment shows up. When someone gets to work late regularly, that's a sure sign they're not committed.
Mm.
When someone gives you excuses why they didn't call you, that's a sure sign that they're not committed to your relationship.
Yes, yes,
Commitment shows up, and it starts with the decision to be committed.
yes. That's so true. Preach, Dr. Michelle. That is so true.
Uh,
The patient is the master of health. Powerful, for sure, for sure.
yes, yes.
So, Peter's saying, how do policy deal with mental health issues affecting, especially men?
Um, there are two questions there, Peter. Thank you. I'm really concerned that, but hopeful. We have a new president coming who sees the need for policy related to mental health. We need additional policy to, first of all, we need to make it as important as our physical health, if not more important. The mind precedes the body. And right now, many insurance have separated health coverage with mental health. So you have to get a separate authorization sometimes to see a mental health professional. The dollars and expenditures for mental health, that's at the policy level. Remember, anytime you want to know if something's policy, follow the money. When there's no money, it's probably not policy related. And
Yes.
if
Can
there's
I
no,
tell you, I've been speaking to seasoned legislators to ask them what advice they have for me, and every single one of them say to me, follow the money.
follow the money, follow the money. If there's no money attached, so in answer to your guest, the question is, um, we need to ensure as citizens of America and our community that dollars are allocated for mental health early, not when someone is Baker Act, when they have to be in the hospital for prevention. So we increase screening, make those things necessary. For people who have been through trauma, we need to have available resources. Things dollars spent is very erratic, sporadic, waiting. And with mental health, it has to be consistent. And we've seen that. And as far as men, we need to encourage, in particular, to take mental health and move the from if you see a mental health professional, you're crazy. Mental health professional is like saying I'm taking in to get a tuna, car is ready to be taken. No, taking care of your mind, taking care of your mind is probably the number one thing you can do for yourself, and then taking care of your body. How do you take care of your mind? First, monitor what goes in. We are too lax in allowing anything and everything to enter into our mind. How do things enter? Social media, our visualization,
Mhm.
our ads, watching television and news. Guard your mind. See what you're putting in and making sure what goes in, you've decided to enter. Conversations that you have with people. Make sure those are conversations that are going to be helpful, useful, and progressive. Don't entertain conversations that are stagnant, negative, and demeaning, and deteriorating and destructive. Those conversations do not help mental health. And of course, whenever possible, if you find yourself in a place where you're feeling anxious, nervous, depressed, seek help early.
Seek help early and often. I love that, Dr.
Yeah.
Michelle.
Yeah.
I love that. Communicate, commitment shows up for
Yeah.
sure. So, morning, Portia. Thank
I
you for tuning in. Thank you for tuning in. So, David says, preach, Dr. Powell. You're a true advocate and a demonstrator of accountability. Yes, promotes it without throwing guilt, makes her, yes.
yeah.
I actually, you know what I was just thinking? Hey, mind over matters for sure. You know what I was just thinking? I was like, I wonder if I could have my family physician all the way in Miami Gardens, and I
Sure
live in
you can.
Lauderdale.
Oh, yeah, definitely, definitely. It's a good point that he made about um, guilt. I hate guilt. Guilt is one
Mm.
of the most useless things that we often do to people. It's paralyzing. Guilt is, I always say, don't be a guilt catcher. If you see someone throwing guilt to you, drop it. Don't let it get to your mitt. Why? Because people engage in things when they don't really want to. And anytime we engage in doing activities and things because someone has guilted us into doing it, it's not authentic. It's not uplifting. It's not powerful. It's not there to raise you up. Guilt is destructive. Don't throw it, don't use it, and don't claim it.
Guilt is destructive. Don't throw it, don't use it, and don't claim it. All right, we need to tweet that one. That was powerful. You're dropping a lot of gems today, Dr. Michelle.
Thank
So let me
you.
ask you, do you practice what you preach?
I do my best like everyone else. I'm committed to working out. I at least 4 times a week, at least for 30 minutes. Why? Because I'm over 50, and over 50, there's no forgiveness and there's no excuses either. If you're over 50, no forgiveness and no excuses. You got to just do what you got to do because your body says you've emptied the bank account, so now you need to fill it back up. So every day, try to do something to exercise, and I do. Do I eat well? I try to eat well as often as I can because where there's knowledge without demonstration is not really wisdom. So I do
Mm.
try to select the foods that I eat. I love lots of fruits and vegetables. I always say your plate should be 50% vegetables, um, uh, 40% in your proteins, and 10% in starches, especially once you reach 50, where the body loves to add and package the extra poundage around the waistline and on the hips, and also pack it around your heart. And we don't want any extra fat around any of the organs because it slows down the organs. So, yes, and also my mind. I read constantly things that will uplift me and make me useful to myself first, but also to the people that I work with. So I guard my mind. I try not to engage in destructive conversation and thoughts, and more progressive, and to fulfill my life mission that's been given to me by God, which is to promote health and wellness and to remind people that they were born whole and complete.
Oh, I love it. I love it. Hey, quick question, personal question. Do you have privileges at Memorial by any chance?
No, I don't have privileges. Hospital work, I used to be a hospitalist for over 5 years, and I stopped doing hospital work because it took me away from the office. But I am in communication with doctors if you do go to Memorial. Yes.
Okay, fantastic. And then could you tell us a little bit about your business, Powell Health Solution?
My business, Powell Health Solution, the name was very intentional. I realized that there are lots of providers out there, there are a lot of health institutions there. And I did not want to just band aid people. I did not want to give them a pill. I wanted us to move towards resolution and solution. And that's where the name came from. It came to create and give solutions for health issues. I decided to work in the community of Miami Gardens in North Miami, where I was raised here, and to impact the outcome. So our whole goal at Powell Health Solutions is utilizing all modalities possible. So I use a lot of alternative medicine. I am open to what works. So if you come to me and say, hey, look, I've been using chromium picolinate, it controls my blood sugar, which it can, I'm down with that.
Yeah.
But I also know if you've been using chromium picolinate and your blood sugar is still over 200, we need to seek out an alternative plan. We do promote weight loss because we know there's a direct link to weight. So I have a weight loss program, and it's weight loss for life. I don't like
Mhm.
using diet plans because it has the word die in it, and people think, die,
Oh,
on
look
a
at that. I didn't think
diet.
about that. Die. Oh, wow.
Mm-mm.
Okay, look at
Um,
that. Okay.
Listen, remember, mind precedes body. So if you're thinking you're dying on your diet, it's more likely not to produce the results as quickly as you would like, and you won't sustain it. So we come up with a customized plan, and it's individualized, that you can maintain for life. So if you don't like exercising, I can't give you a formula for exercising, because that's not practical and it's not you. And at our practice, we work with all ages. We do work with hormonal imbalance. We work with women's health. We do gyne, and we do work with children, fulfilling the mission of bringing solutions to our community.
Oh, I love it. I love it. I love it. I love it. I know you've already dropped a couple of gems, but do you have any final words of wisdom that you want to share with us today?
Wow. First, as we talked about, make a decision for your best health. It starts with a decision. The second thing, now that you've made the decision, show your commitment by setting up a plan and working that plan. And third, guard your mind. Really, I'm serious about the guarding the mind. Um, I remember my partner says to me, every time I open up my phone, it's something about Trump. Guard your mind of what comes in to your phone, on your television, on your computers. Make sure it's something, as I said, that will lift you up, motivate you, and watch the circle of individuals. Look who circle you, literally encircling you with their consciousness and their energy. Make sure that the people in your life, whether they're family or friends, are truly supporting your best health. So the pearls are, um, watch it, clean it, and do it. Watch
I
it,
love it.
and clean
I
it up
love
if it
it.
needs cleaning up, and get out and do it.
All right, fantastic. Okay, so if I go to your website, I'll see all the insurances that you accept,
Yes,
yes?
yes, yes.
All right, fantastic. I'll be in touch.
I
I
look
like
forward
it when I
to
love
it.
my doctors.
And just for you personally, I'm so proud of the work that you're going to be doing. And I know you started working out now,
Yes,
running and
yes.
walking, which is great. And you decided that your meal prep will happen twice a week. Another pearl is mix up your workout every 6 weeks. You'll see a big difference. Every 6 weeks, do something different. So if you're
Thank
running,
you,
start
thank you,
walking. If you're
thank
walking,
you.
start weight training, jump rope. And by the way, you can carry a jump rope anywhere. Love it,
I
love it.
love it. I love it. All right. So Peter says, stay humbled.
Thank you. Bless you.
Indeed. Indeed. Decision, commitment, guard your mind. That's it. That's the
Yeah,
takeaway, Portia. Thank you so much
yeah.
for watching. Dr. Powell, thank you for taking time out of your busy schedule to
I
share with my
appreciate
audience this
you.
morning.
I
I
appreciate
appreciate
you.
you.
Thank you so much. Take care.
All
Have a
right. Be
blessed day.
well.
Be well.
All right, everyone. Thank you so much for joining us for this episode of the DunnWisdom Morning Show. Remember, be kind and loving to yourself. Oh, by the way, if you're in South Florida, I'm getting sworn in tomorrow. We are going to be streaming it live on, I believe we'll stream it live on this channel as well. We'll share it from the campaign station. We'll stream it live here so that you can watch my journey come to fruition. Be well. See you tomorrow.